Hi everybody, this is Rhys Barber from Audiology Associates. Thank you for watching our earwax removal compilation video today. This patient's got some very deep-seated wax. You can see sitting on a bed of dry skin. That's the wax, so we're just pointing out that darker material. And the blue sort of crescent you can see there is actually the eardrum. So you can see how deep that this section of wax was. It was sitting right on top of the eardrum. We're seeing a lot of these types of patients coming through recently just because of lockdown. People couldn't get their wax removed. You're getting lots of very dry, deep-seated earwax coming through. So we've got the standard size ulnar tube in here. Now the first thing we need to try and do is dislodge this wax. So we're going to try and lift from the skin there. You can see just peel that skin upwards, because if we try and pull that center section straight away, what's going to happen is that skin's going to hold on to that wax and it's not going to budge at all. So we need to just kind of gently lift this off. Now if you've watched videos before, you know that this part of the ear canal can be very, very sensitive. So we have to be really careful on not to touch the canal walls as best we can. So we're just hovering the suction tube just above there. Do you see a little bit of movement there? And you can also see where it's starting to peel that skin away, that kind of spider webby sort of look to the skin underneath. So we're just starting to see a little bit of movement. So we're just going to try and lift from the front end there. You can see it's really, really lodged in there. We can't do an extreme kind of movement, that extreme wiggle, because it's so close to the eardrum. We run the risk of pushing the back end of that in towards the eardrum. So we're just going to gently lift from the sides, slowly teasing this off the canal wall. We can just start to see underneath now. Look, we've broken that adhesion with the skin there. So it is starting to become that little bit looser. See how much more freer movement to the wax there? So we're going to introduce a little bit of olive oil in, which is just going to get underneath that section now, which is going to stop it from re-sticking. There you go. You can see it's actually broken apart now, that dry skin. So we need to take this section off the right hand side. It's really stuck there. That's what's holding it in. So I'm just going to start peeling from a bit further back, because if it is dry skin, we can use the dry skin to our advantage and we can lift from further back, and that dry skin will lift all the way down and loosen this last little bit of wax here. Really starting to draw away now. You can see it just pulling that top section there. As we pull forward, notice how it kinks the bottom section further back. So we're going to struggle to pull any more down now without pushing that further in towards the eardrum. So we're just going to hold on to this section. I'll bring this forwards. Please stay tuned, guys. I've got a question I want to ask you later on, and it really does have an impact on the channel. So stick with this video. I'm going to put a poll up a bit later, which I want you to really vote on, please, which is going to sort of, you're going to decide the way this channel moves forward. So I really want you to take part in that poll if you can. Enough of that. So we've got a good grip on this section now. We're pulling this forward. You can see we're just taking this section away. Look how all that's held together. You've got that white skin material, the darker, harder material then on the inside. When you take a look at the eardrum, look, we've got missing a light reflex here. The light reflex is really dispersed because of the position of the eardrum. It's drawn in. Mottled effect to the skin, blue-grey in colour. So this eardrum is quite drawn in. It's not really good light reflex. We've got that kind of mottled sensation over the top, just where that wax has been trapped down there for so long. So we've got 3/4 of a centimetre, 3/8 of an inch. So this is the second patient in this compilation. You can see we've got a very similar story, but the wax in this case is much wetter. See the sheen that appears on the front end of this wax? Usually a good indication that some oil's gone in, plus you can see a little bit around the entrance there as well. So this is the standard size ulnar tube again here. Just slowly, very, very slowly working our way down, looking at how the wax is getting sucked into the ulnar tube there. So that's what we're looking at, is looking to see how much of it is getting sucked in there. We can see that we've got this section to the right hand side of the eardrum that's still covered, and we can see the wax getting sucked into the bottom section, pulling out of that valley there as well. There we go. So just holding the suction tube there. Now watch as this starts to get pulled away. There you go. So you can see that section. We just slowed that down there. It's actually drawn the wax out of the valley a little bit for us here. So it means we can get a good grip now with the standard size ulnar tube. Holding on to it there. There's a little bit of dry skin in here as well, which is just helping us a little bit because it's pulling more of this material and this sort of debris out of that valley again. Just aiming just slightly above the canal wall. Look on the right hand side. Holding the suction tube there. Drawing now. See all that peeling away. See it jump out of that valley there, and then you've got this last little piece here. So we'll just slowly work our way down to this using the standard size tube again. There we go. We've got one last little bit there you can see. So we'll switch now. We'll pop the fine end on just because we can be a bit more accurate with the fine end when you've got these smaller pieces. I'm just going to take that last little lump away. There we are, just taking the top off it there. Perfect. And there we are, you can see the eardrum there as well. The light reflex on this one also quite diffused. So you can see, you get this quite often with patients. You can see this kind of very diffuse light reflexes sometimes. So we're into our third patient now. Obviously everything from the last one got sucked into the tank, so we couldn't show you that one. But this is our third patient. So this patient's got some deep-seated skin right next door to the eardrum, so slightly different. But look as we get a grip on this now. Watch this as it peels away. So we've got a grip on this top layer of skin now. We're going to draw this towards the camera. This is the fine end on here, very, very deep again. Look how much of that skin is down in that little gully there. Still coming, there we are. So this kind of long ribbon of skin that was trapped down there next door to the eardrum. You can see we've got still a little bit of wax deeper in. So we're going to stick with the fine end there, slowly. There you go. You can see the grip. Do you see it come towards the suction there? So we just sort of jump towards the suction. That way then you know you've got your good grip there. So we're just slowly holding this on, very gently drawing this back down the canal. We've got to get it around this bend. So you can see that narrow pinch point there we've got to get it through. You can see all the oil that's gone in there, all around the outside edge there. That was a patient that put that in before they came along. There we go. So that's drawn that larger section away there. So we've got a little bit there to the right-hand side on the canal entrance. So we're just going to nip that out of the way because obviously that's going to plunge straight into the camera. And now we've got this little piece tucked around the corner. So what I'm going to do here is lift this dry skin from the right-hand side of the canal wall. And we're going to slowly peel this down towards the eardrum, which we're going to hope then is going to draw this last section away. So we're going to hold, there you go. Did you see that last section jump out from that little gully there? Very, very difficult to get the tool in around the corner. So we tend to use what we have in the ear canal there. So we're just going to lift off from the side, lift that dry skin and allow that to do the work for us rather than try to bend it around that corner. Very dull looking eardrum there. So this is what we removed. So we've got 2.5 centimeters. Oh, I can't quite see the inches. Oh, there we go. 1 inch and a quarter. I gotta go easy. 1.25 inches on that one. Okay, so this is the last patient in the compilation. You can see very, very dry wax sitting in front of the eardrum here. Just going to go in with the standard size ulnar tube here to loosen this up. There's a little bit of olive oil in there to try and loosen this. We've got to peel it away from the canal walls as we've done in the past. There is one thing I need your help with, guys. We are really torn at the moment. You seem really divided about which format you like to watch on these videos. So what I'm going to do, I'm going to put a poll up which should appear around about now. And if you could decide, do you want to carry on with this particular format where we just do the voiceover and you don't actually see me? Or would you prefer us to do the voiceover with me in the corner, but rather than me kind of do the description at the beginning, we just launch straight into the wax removal? So I'm going to put a poll up on the video every day this week. Please vote on it because it will then, whatever's the most popular of those two votes, we will then move forward with. Okay, so if you can do that for me, that would be brilliant. At least I know what you guys want to see then. Don't forget, you drive the channel, you decide what you want, how you want to see this stuff. So please vote on the video because it does make a big difference for me. Okay, so we've just peeled away from the right-hand canal wall. And you can see we're slowly lifting this back. It's got kind of stuck there. We've peeled it as far as we can without it getting stuck further. So it's not going to dislodge easily with the suction there. And using the fine end, you're not going to get that really good suction grip there. So it's holding on to this now, teasing this out, just slowly trying to hold it. It's so thin that if you clamp too hard on it with the forceps, you're going to shear straight through it, which is kind of what we're almost doing there. You can see we're just pulling it there. Do you see it shear through there? So we're just going to switch position now. We've got a nice flat edge to get a good grip on. We can get more of the jaws of the forceps on it. Back in. It's dry, don't forget, to the shape of that canal. So when you're trying to get it out of a smaller gap or the entrance to the canal, it's not always the right shape to fit out. So we just need to pull this through. There you go. And if we take a look in now, what you'll see, the eardrum itself looks good, but we've got, see this section at the top of the canal, ear canal there, so we've just got to pull that bit down. It's quite sticky wax with a bit of dry skin underneath, so we're just going to pull that bit down there using the fine end, just working my way along it, trying to find where it's loosest. There we go. Look at that skin look underneath. See, that's what's holding this on, is this drier skin layer. Let's pull this down. There you go. Out that comes. You'll see that little bit of dry skin there attached to the back. See that there? So that's what's held this piece up here at the top. Eardrum looking a lot better. See the difference in colour, smoothness of the skin compared to the first one you saw. So we're just over 3/4 of an inch, 2 centimeters there. The bit to the right hand side is that bit of dry skin we took away.